So I want to introduce Dr. Zarian. Uh, in this topic, we've called it Changing Movement Through Treating Scars with Acupuncture. Dr. Mahmoud Zaerian has been in the health field for close to 27 years, working the majority of that time with athletes as both a strength and conditioning coach and now on the therapy side as a chiropractor. During his time, he has been the lead medical doctor for Gymnastics Canada, a therapist with Athletics Canada, and consulted with a few other sports organizations, both professional and Olympic. Dr. Zarian is the lead instructor of Advanced Therapeutics Program, offering education on advanced rehabilitation guidelines, advanced needling acupuncture strategies, and assessment tools. His fundamental understanding of the functioning of the human body was most noticeably demonstrated when he reduced shoulder-related injuries amongst the sports teams he worked with in a 10-month period from 72% a rate of occurrence to 11%. I will ask Dr. Zarian to continue the presentation, and after the presentation, we'll do a Q&A. And if I could get everyone to type their questions in the question and answer box below, we'll get to all the questions after his presentations. Thank you. Take it away.
Thank you so much, Celine. Thanks. I'm going to share my screen here with all of you. As I'm doing that, I think it's worth just thanking you for putting together this. I'm sure other presenters have said this as well, for putting this together for all us clinicians and practitioners to help us continue to expand our ability to effectively help our patients. I think this is wonderful. I think collaboration, information learning like this is really great. And for me, I'm particularly grateful because I love talking about the human body. I love reading about it, learning about it, and mostly trying to interact with it in unique kind of ways. And I thought I'd start this discussion with all of you, or this case presentation with all of you, sharing a little bit about an Indian parable that I came across, I think 15 years ago, that really stuck with me. And I think it's apropos given this series. And it's about these blind men that come upon an elephant. And each of them grab a different part of the elephant and describe the elephant based on the part that they're feeling. So the one blind man grabs the trunk and says, oh, it's this big cylinder that's malleable. And one grabs the leg and says, no, an elephant is a big column, hard column. And another blind man grabs a tail and says, no, it's more like a whip. And when I think of this parable, I think of the fact that, what we're dealing, when we're working with the human body, mostly, like most things in nature, we're always evolving our understanding, and we never really come to a point where we fully grasp the totality of it. And each of us carries, a unique perspective, a unique approach into relating to the human body, treating the human body. And I hope I can be one of those unique perspectives for you today with this particular case presentation. So I had all these thoughts go through my head about what case I'd want to share. I shared about the successes I had with shoulder-related issues with the different sport organizations that I worked with, because some of them were really remarkable, and I thought, those would be great cases to share. And then ultimately, I decided to talk about scars, and it was really simple. The reason why, one is really early on in my practice, when I was first, using needles with my patients, it was this particular case that I'm sharing with you that allowed me to see the potential that this modality, acupuncture, can provide for us as practitioners. And then also because regardless of whether we're working with athletes, whether they come in with a shoulder issue, a knee issue, an ankle issue, a low back issue, I think there was a recent epidemiological survey that was done that said, 1 in 2 people have a scar in their body, and close to 1 in 3 have a surgical scar in their body. And those are the ones I'll focus most on today, because like a lot of things in medicine, the practice of medicine, we have sort of these iatrogenic effects where we create some deleterious outcome in an attempt to remedy a situation or improve a case. And I think scars are one of those. And all of us will have a patient with a scar. And what I hope to share with this case is, regardless of where this scar may be located, it could be having impacts on your patient as it pertains to their movement capacity, and then ultimately the manifestation of any pain they may have as a result of loss of movement capacity. So we'll talk about the case presentation, and then I'm going to just provide a little bit of a background about how I view, how I approach treating the human body, because it's important, because that's what had me take the approach I took with this particular patient in treating her scar. Before I go any further, I should probably just mention to all of you, I've come down with this little bronchospasm issue, and in the evenings I get into these unrelenting coughs. So I have a throat lozenge in my mouth. Usually does the trick, so I apologize. I know it's a little bit rude to talk with something in your mouth, but it's so that I don't cough incessantly with on this presentation. Okay, so there's a lot, there's a lot. I'm not going to go too in depth in talking about a lot of this stuff. I think this is stuff that you're probably all somewhat familiar with anyways. There's a mechanical component to scars that we're all familiar with. There's a damage to the structural integrity of some part of our body, or sometimes the structural integrity is damaged in an attempt to go in there and do some surgical procedure. Like, let's say you having a scope done on your knee, or having an open heart surgery, whatever it is. There's an incision, there's a damage to the structural integrity, and that wound that's created goes through phases of healing. And we know that one of the outcomes of this is that we have a change in the ratio of type 3 and type 1 collagen. And as a result, we may have a stronger tissue, but we have a less resilient tissue. We have a tissue that's less elastic. We have a tissue that is not able to deal with force equally in all directions. It's a little more, the fibers orientation is a little more parallel, as opposed to sort of a basket weaving approach that allows it to be able to handle forces in all planes. So these things are important, and the more we can minimize some of the negative consequences of a scar that's not healing well, the better. And there's a lot of various soft tissue approaches that we can take around scars. But one of the elements of scars that I found really interesting is it has a strong implication in terms of the input it's providing into the nervous system, into the body, and specifically around, because of all the neurological stuff that's going on around the scar. So the moment we have tissue damage, and that could be because the trauma happened because they fell and caused the damage to their skin, or in the case of, let's say, a surgical procedure, in their attempt to get into the deeper structures where they want to provide the intervention, they cause tissue damage. They're ripping through tissues at various different depths and layers. And this triggers this sort of nociceptive effect. We have these specialized cells that get activated through this mechanical irritation of ripping the skin apart, or the tissues apart. And it floods our segment associated with that area with nociceptive input. And one of the interesting things and unique things about the nerves in our body is it has this sort of axonic reflex, meaning it has effects up the chain, up to the segment, but also back down to the injured site. And what can happen with scars, especially scars that are not managed well, or patients who don't manage their health well, so their metabolic system is not as capable to deal with the recovery of the scar, you have this sensitization that can occur at the site of the scar. So what this would look like is you have sensitivity to touch in and around the scar. The interesting thing about that is we have nociceptors that get stimulated through mechanical stimulation. So I'm a surgeon, I cut the skin open to get to the joint that I want to do a particular procedure in. I've stimulated mechanical nociceptors. Well, this axonal reflex, this sort of signaling or response that's being sent to the segment and then back down to the injured site, releases various different mediators like substance P, like CGRP. These things, these sort of mediators, then trigger the activation of adjacent nociceptors that are not mechanically sensitive. A term that's often used is, they call them silent nociceptors. So then it creates this increased amount of input that's coming from the surgical site. It's causing a reduction of the threshold of activation, meaning now it requires even less mechanical irritation or stimulation to activate these nociceptors. All of this sends a whole bunch of input into the segment. And if you look at the body, as a series of inputs and outputs. Well, if the kind of input that the body is receiving is noxious in nature, it's going to alter the kind of output that's coming out. And so I'm going to move on to well, actually, before I talk about the case, this is why I love doing needles around scars and why I want to talk about this is if we want to try to put our hat on what acupuncture is doing in the body, I think a very easy and a simple place to rest it on is the fact that it's affecting the nervous system. When acupuncture was first being examined and explored and tried to be learned here in the West, like what's happening in the 70s, a series of studies came out that pretty much showed that if you don't have a healthy central nervous system, if you don't have a healthy peripheral nervous system, then the effects are minimal at best. So it's I think it's a strong, easy place for us to say that what we're doing is affecting the nervous system. And given around scars, we have this sort of massive disruption of neurological behavior and the input to the segment. This becomes a really great modality, a really great tool to use around a scar. So without further ado, let me get into this case. And I thought this was such an interesting case. This is early in my career. So this is a 49-year-old female, post-surgical shoulder pain. And the original incident of her injury was in 2006. She was training for an Ironman, riding her bike, and was hit by a car. She flew over the car, landed on her shoulder, and fractured her shoulder just below the humeral head. Originally, she went and had an open reduction internal fixation surgery. You'll see pictures of it in a moment. And as a result of this surgery, she had no external rotation. So she had full internal rotation, but no external rotation past what would be considered neutral. 3 years later, she had a hemiarthroplasty. So they removed portions of the bone, put on a prosthesis, and they did it in a way to try to fix for that lack of external rotation. So she gained external rotation back to be able to do the activities of daily living. But as a result, she had lost all her internal rotation. Now, before she came and saw me, she had seen various physiotherapists, various other people who've done acupuncture on her. She saw an osteopath, various modalities done. And so she came and saw me. And the reason she saw me is she still wanted to do this Ironman, and she's, wanted to see, okay, maybe this person could do something different. And I want to tell you, when I was sitting in there with her, she's telling me all the lists of things that she has done and mentioned that she'd gone acupuncture from 2 or 3 different people. And at first, and I'd asked, where did you get acupuncture? What were the treatments like? And at first I was like, I don't know what difference I'm going to be able to provide for her. She's clearly has gotten a lot of interventions done, and she still has pain. And on top of that, she still has no internal rotation. So I did an assessment, and I'll just first share the radiographs with her. So that's from the fracture that she had, and that's the open reduction internal fixation that she had with all the pins. Eventually, I don't have the imaging for it. I wish I did, so I can show you. She had a prosthesis put in. So when she came in, we went through an assessment and an examination, and there was equal amount of internal rotation passively and actively. So you'll see her active internal rotation. I wasn't able to move it past that point passively either. I wouldn't say there was a hard block, but it was definitely blocked. It wasn't going to go anywhere. And there was some reduction in shoulder extension as well. She had sufficient external rotation. It was nothing extraordinary, but it was sufficient for her with what she needs to do. There was some inhibition. And so by inhibition, what I mean is as some of the fibers associated with the movements listed here, shoulder flexion, horizontal reduction, as those fibers were loaded, the continual loading of them, the nervous system wasn't sufficiently able to get more muscle fibers involved to meet the demand of the load. Which, oftentimes is indicative of some underlying neurological, I'll use the word disconnect, that's going on. And then there was some mechanosensitivity around the scar, some allodynia. And the moment this happened, I thought to myself, I think I know how I'm going to approach this treatment. And a little insight about me, someone once said to me, if you want to be masterful at something, you predict the outcome. You say this is why it's happening. and this is what's going to remedy it. Do this and produce the result that you're going to say. So this always stayed in my head. This is someone in another profession. And so I oftentimes put my theories to the test. And so I said, you know what, I think this scar is actually what the biggest limiter to your movement and your pain is. And so that's all I'm going to treat. So that's all I treated. So you'll see a picture of the treatment intervention in a moment. Actually, you'll see the internal rotation first. So this is her going through internal rotation. And that's sort of the point where she gets stuck. She can't go any further. You can see there's like a little bit of a wobbling that happens. There's poor motor coordination for her as she's getting to that point. I wasn't able to move that passively any further than that. So the treatment was needling done around the scar. I'll talk a little bit about needling around the scar. In this case, I just threaded it, not too deep underneath the scar. I kept it fairly superficial. There was 11 total needles. When I was assessing the scar, the more superior portion of the scar, there was a little bit more sensitivity in that area. So I had a higher frequency going at that higher lead and then a lower frequency at the below that. And I'll talk about the frequencies, why I chose those in a moment. But I left that on for 12 minutes. And that was it. So I took the needles out. This is the moment of truth because I said that's all I'm going to do on her. And so this is just to show you again what that internal rotation looked like beforehand. And then as you can see, just her starting point is better than where she was, the way she finished. And then she went to do internal rotation. No problem. She was able to get, and that was, we found out later on, that was the maximum amount of internal rotation she'd be able to get because of how the surgery was done. And obviously she was really pleased. Her internal rotation was back to the full amount that she had available to her. The pain was significantly reduced. We did treat it more often to deal with the pain a little bit more. One of the things that happens with a scar, especially a really major scar like this, you have this peripheral sensitization that happens, and then you can have spontaneous activation of nociceptors, meaning they're not even mechanically stimulated and then spontaneously, depolarize and activate. That contributes to a lot of people's chronic pain in a surgical site around the scar. So sometimes it takes a little bit of a number of treatments for us to normalize that behavior. So we did need to treat that a few times, but even after this treatment, she had significant reduction in her pain, enough that she can go back in the pool, swim. She was swimming even with this limited internal rotation, but she had a great degree of discomfort, a lot of pain. So after this treatment, she was able to go swim. Her next two swims, she was able to do with much less pain, much less pain. And then we continued to treat it, continued to work around the area and address some of the deeper fibers that we didn't in this first treatment. And when I saw this, this is early in my career. I'm in the sports world. I'm interacting with a lot of sports doctors. There is prejudice and maybe in opinions of what is possible or not possible, or why something is behaving a certain way. And generally speaking, when I would interact with various different people in the medical world on the sports side, rarely is the scar something that they discuss as something that could impede movement, that could have deleterious effects on movement. And I work with a lot of athletes who have a lot of orthopedic surgeries, and they're my favorite thing to do is treat them post their surgery because of the improvements we can make in their movement capacity and their body's functioning, just addressing the scar. And I thought this was a really great case because what she was told beforehand was that was her internal rotation. She isn't going to be able to get any more, and that was because of how the surgery was done. There was going to be limitations, and this was a limitation she was going to have by the sports doctor who had done the surgery for her. And all the therapists who attempted to deal with the pain and attempted to improve internal rotation through various different modalities or approaches they took, they weren't able to fully deal with whatever was the barrier for her, in this case, the scar. And so, I look at movement very much as this sort of expression of complex interactions that's happening. The body at any given moment of time is dealing with various different inputs from the external environment to the internal environment of their body in terms of what available ranges they have, what terrain they're on, to figure out the most efficient way to move. There's psychologist, Esther Thalen, who has this really wonderful quote, and I don't want to butcher it, so I think I have written it down here. I want to say it to you exactly how she says it because I think it is so well said. Bear with me. She goes, all of the subsystems spontaneously self-organize or come together and interact in a specific way to produce the most efficient movement solution for each specific task. So, we go to do a task and we have this complex set of interactions that's happening to find the most efficient way to move. Now, the most efficient way to move could be limited, and it could be limited to the various different things that are going on within the body. And so if you look at the body as a system, like I do, there's common tenets that any a system has, and that is it's predicated on connectivity. You need good connection amongst its various different parts. If there's some disconnect, the system is not going to be able to execute or self-organize itself in the most efficient way. Systems do self-organize. The human body is an example of this. There's a really wonderful study where they looked at a pitcher throwing the same pitch 100 times, and for 94 or 95 of them, the body moved slightly different each time to execute that same exact pitch. So there is a self-organization that happens that allows for the emergence of movement, and this movement is unique in the way this happens. And so when I look at the human body, a lot of times I'm looking at, okay, where is there connectivity that's not present or it's been lost? Where is the system lacking its full capacity to move in certain areas? It's limiting its ability to self-organize in the most efficient way, to have movement emerge in the most smoothest and efficient way. So just to give some insight into my thinking a little bit, how I was approaching this case, I saw her and I saw the mechanosensitivity, the allodynia around the scar, and right away I said, okay, there's some active nociception that's going on. I know there's some sensitization that's happened peripherally, and all this is going inputted to the segment. All these inputs from the nociception is going into the segment, and it's altering the output. In the case of her, it manifested itself in terms of poor motor coordination, inability to go through certain ranges, and possibly not going into those ranges because as she went into those ranges, the tension on the tissues where the scar was going to cause even more. What the threshold was already activated. The body said, no, 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 we can't go any further. And on top of that, our skin is highly innervated by the autonomic nervous system. So a dysregulation to the autonomic nervous system as a result of the scar, that also goes and gets inputted into the segment and affects what can be outputted in terms of what movement can happen. So all this was going through my head as I was palpating, assessing things. There's a lot of different ways I could have given an input for her, but when I saw that, okay, this scar has clearly not been, even if it's in the past been addressed through some of the soft tissue treatments that she had gotten, it hadn't been fully resolved or dealt with in terms of dealing with the negative consequences of that scar on her body in terms of how it's affecting her movement, right? If there's nociceptive signals coming into the segment, and disrupting motor output, we have a little bit of a disconnect that's happening that may have been contributing to the presentation of her inhibition during those planes of motion. And if now that's causing her an inability to handle load or move through certain ranges, she's now reduced the capacity to move and the capacity for her system to self-organize and allow for the most diverse sort of emergent movement that can be possible. So what were the outcomes that I was trying to accomplish with the needles, and what are the outcomes that the needles produce in this case? Well, first and foremost for me, I wanted to inhibit it and normalize the thresholds of those nociceptors. And it's not, in this case, we had a really great result on the first go, and it really built or further gave me confidence to trust the way I go about treating with the needles, which was great. But sometimes with some scars, it requires a lot of, not a lot, but a few treatments to help normalize that. It's not always going to be perfect on the first go. Or what will happen is you'll get some improvement, maybe not 100% some improvement. And then they go about their day. Let's say they have a shirt on and that shirt is rubbing against that scar, causing further irritation to a nociceptor whose threshold hasn't been fully normalized, which creates more irritation, has a sort of positive feedback loop, creates more irritation. Then they come in your next visit, and some of that gain that you produce has been lost. So sometimes this treatment needs to be repeated a few times. That superior portion of her scar that was most sensitive, I did end up treating, I think, on 2 other occasions to get it to the point where I was satisfied with where it was at. The other thing we're doing, as mentioned, because of the rich autonomic innervation of the skin and the fascial tissue, is we're modulating the autonomic nervous system. One of the things I learned earlier in my career is the first thing physiologically the body cares about, and I speak as if I'm the body because I look at where the body is giving its attention. But the first thing the body cares about it during any kind of an injured state, acute or chronic one, is regulation of the autonomic nervous system because there's been some dysregulation done. And in the case of a scar, we have that because we've actually caused trauma to the richly innervated tissues of the body from the autonomic nervous system. So I was trying to modulate the autonomic nervous system, and which also is providing an input to the segment that affects the output in terms of the movement that then gets produced. And then there's, with needling, especially if you sort of time it well, it can really support the different phases of the tissue healing. It could actually support the release of certain mediators to help in the proliferative and remodeling phases of tissue healing. So we want to maximize on that. In her case, it was maybe a little bit later on. We were sort of past the remodeling stage when she came and saw me. So we may have not been able to maximize as much on that, but that was something else that you can leverage with the needles that I find wonderful. You don't lose out. Sometimes with the various different soft tissue approaches around scars, with the intent sometimes to affect these phases of wound healing, you don't lose out on that with the needles. You just do it slightly different ways, and there's lots of research to show that you actually do support it. And then lastly, just to improve neural drive, if I look at how movement, first of all, I take the case that if there's one purpose to this organism that we call the human body, then I would make the case that its purpose is movement. And I make that case because if I look at all the different behaviors, including speaking or chewing and eating, it all involves movement of something for it to be happen. A large portion of our brain's functioning is geared toward movement of something. So if I say that the main function of this organism, the human body, is movement, and then I look at, okay, what governs movement? And I look at the brain and I look at its extension, which is the nervous system, then I want to try to, as best as I can, give inputs to regulate and normalize any sort of afferent or input coming into the system and modulate the kind of output that's coming out. So in treating the scar, that's how I looked at it. I looked at this as something that's providing input into the system that's creating some dysregulation and inability for this system to modulate itself appropriately for really good fluid output of movement. And so with the needles and treating the scar, there was this added bonus of trying to modulate the segment associated with that area so that we get better motor coordination, better joint motion. Some considerations I keep in mind when I treat with my patients with scars, obviously I want to make sure the sutures are out. That's not to say that I don't necessarily treat someone who has sutures in them. With the athletic population that I work with, and with some of these athletes, I'm their primary caregiver, and I'm the first person they see post-surgery. So I may not go to the site of the surgery or where the sutures are, but I will definitely go try to give some input to the dermatome or of that area. So segmentally, I would try to go and find the segment associated with that area, provide some input to the segment. Again, the needles become a really wonderful tool to try to do that. If there is a prosthesis, I just want to make sure, obviously, it's not something that's conductive. If I'm going to introduce electrical stimulation to the needles. So I keep that in mind when I worry about depth or of the needle and how deep of a layer, how deep I want to work on. And this is something I've learned a little bit more as my career has gone on because I had this wonderful case earlier in my career, and then I became really gung-ho to treat scars and do a lot of needling for it. But one of the things I learned, sometimes less is more. In that, you don't, if you're unsure, I've become a little bit better to sense and know when I can go at a scar really aggressively with needles, with stim, and when I shouldn't. But if you're not as clear, or if you were me 10 years ago, less is more. Start addressing the dermatome to that area, and then address the motor fibers that, or the peripheral nerve that's associated with the motor fibers in that area. Then, gradually you can move towards a scar. Um, I've realized I don't always have to go at it really aggressively. I threw 11 needles in her. I may have been able to get really great results without having to do 11. If she had come to me very soon after her surgery, I probably wouldn't have done all 11. I knew this is well past the remodeling phase, and um, hence why I did as many needles as I did. The other 2 points sort of just speaks to that. Um, I want to show you a quick little video before I just sort of wrap up. There's two other clinical cases that I can talk about, but maybe some of your questions will bring it out of me. So I'll see what some of the questions are before I mention them. But I want to share this video because I think this is a really great video that demonstrates sort of my thinking behind why I chose treating this case and scars in particular. So I don't know if I don't know if there's volume to this. I hope there isn't. But there's wording, so it's going to probably tell you what happens, and maybe afterwards I'll give you my little 2 cents. Oh, sorry. Actually, I'll just mention one thing. This is Yellowstone National Park. They had an issue with deer population. The deer population was out of whack, and there were some suggestions to go in there and shoot the deer. And some really great thinker, said, "Why don't we introduce wolves?" So this is now telling the story, and then I'll come back and tie this into our clinical case. Okay, I shared that video because one of the things I said about what had me be so interested in treating the scar was the way I sort of look at the human body, and I look at it as a system, and every system is made up of interacting parts. And I thought that video does a really good demonstration that, as practitioners and as clinicians, if we take on this perspective, right, to look at the body as a system, if we get interested in what are all the different elements that potentially, if we can give an input to, can help, that input can help normalize or regulate or modulate the behavior of the system as a whole, so that the system could, on its own, self-organize in the most efficient way possible. I look at the human body as this magnificent work of art, and I think it's pretty oftentimes we just sort of have to give it or take away what's in its way to do what it needs to do. And so that's how I looked at this case. I said, what is the input? What is, the issue with Yellowstone was they thought that the solution was to kill the coyotes. It wouldn't eliminate the issue, just like her surgeon, and some of her practitioners were thinking, well, we could actually, I didn't mention this, there was some discussion about going in there and trying to improve that internal rotation. Another surgery. Obviously, this second surgery or third surgery will have been another insult to the body and would have created ramifications that we don't know about. So I looked at this case as also a really good demonstration of if we can just look for what's the input that I can give, or where in the body are things being inhibiting the body's natural modulation capacity to self-organize into an efficient movement strategy. And so that's what I did with this particular case. So I have a couple of other cases. I don't know if there are questions. Some of your questions may actually speak to these cases. So I don't know if I should get into them and maybe see what the questions are beforehand. Maybe I'll see, Celine, what you think.
We can start. There's one question and see if there's other questions that come up. And if not, you could pop into those different cases.
Sure, sure.
So the one question that somebody had talked about, and I think you touched on it a little bit, is in your experience, what's the soonest after total hip replacement surgery to start treating with acupuncture for both overall recovery and scar healing? And also, I'm not sure if you use other modalities, but what either needling techniques or other therapies like cupping or gua sha would you use or avoid for the scar?
Okay, great question. So I don't think there's as far as providing care for the overall well-being, I think you can do that immediately. And if we're just speaking about needles, a hip replacement is a pretty invasive. It's quite an assault on the human body. If you've ever seen videos of what they do with hip replacements, so anything to help the system regulate as quickly as possible. So even if you're not going to the site of the hip, if you have needles at your disposal, you have all these sort of points in the body, in the head, in the ears, and the hands and the feet that have large systemic effects that you can leverage early on to normalize or some of the dysregulation that's happened. And as far as the scar itself, I've gone it worked around the scars as soon as getting the sutures out. So I think it requires a little bit of assessment to see the health of the tissue around it, the degree of irritation. If there is a lot of irritation, I may not needle, so like in that picture that you saw of this patient, I may not be so adjacent to the scar. I may start the needling of the scar of the dermatome or the muscle fibers that or the peripheral nerves around the area. And traditional Chinese medicine, they have this sort of circle of the dragon technique, which is similar to what I did with that patient. You can just broaden that circle a little bit. You don't have to be so close to the site of a large inflammatory process that's going on. So it could be as early as when the sutures come out. If you around the scar, you just may be a little bit further out until the tissues, feel and look like they're not as I'll use the word irritated. Um, an old mentor of mine once said, you don't want to take gasoline to a fire, and the needle is also a large input to the body. So if the area still is very irritated, or you don't want to then go and throw a needle because it could have some adverse react or effects, like not as great of a therapeutic input. So I hope that answers your question. As far as other tools, I do some cupping. I do a lot of soft tissue. I'm a chiropractor, so I do some joint mobilization adjustments. And my background as a strength coach, I do a lot of corrective exercises. In the case of let's say dealing and treating with scars, usually the approach that I take is I use cupping around scars. In my personal experience, I have a greater therapeutic outcome with the needles. So I tend to stick with those. It's not to say that with the cups you won't get some improvements. I think you will.